Do different seating positions affect the pressure in your lower back? The short answer is yes, they do. Every day in clinic we have patients telling us that how they sit and what they sit on has a profound influence on the severity of their symptoms. Hi, I'm David Fitzgerald, practicing physiotherapist for over 30 years, specialising in spinal rehabilitation. If this is the first time you've seen our videos, please feel free to subscribe to the channel so that you can get regular weekly updates on all health tips related to physiotherapy. Most of us have been told not to slouch by our parents at the dinner table, by teachers at school, and of course with health and safety lecturers teaching spinal health in a work situation. In a previous video we discussed the general effects of sitting on the pressure within the intervertebral disc, and now we're going to look at a bit more detail at how different seated positions have different effects on the lumbar spine. Not all seated positions are created equal. Sitting in a slouched or flexed position is generally considered to be the most detrimental position for the lumbar spine, and that's generally because a slouched seated position has the same effect as being in a bent forward position, and as any of you know who've been held to a forward bent position for a long period of time, it gets pretty sore and uncomfortable. But in the sitting situation, as we previously mentioned, you're not usually aware of extra physical work because it's quite a relaxed position. But if we sit in a flexed crouch position, the result of that is that it ends up putting a straining pressure on the back portion of the fibres of the annulus. The central portion of the disc, the jelly-like material, gets pushed towards the back, and if that's sustained over periods of time, we end up with damage to the fibres of the annulus, which we had again discussed in previous videos. And if that goes to its full stage, you end up again with that type of a disc protrusion where the material pushes out to the outer annulus and can cause compression on the nerve depending on the size of the bulge. So sitting with a prolonged flex position, typically we see people now who are doing a lot of laptop work and maybe doing that from home on a sofa, which is very hard to control your spinal position. And whilst you might get away with that in the shorter term for half hour, an hour, if that's sustained over many hours repeated on a daily basis, then that tends to have a negative effect. And that of course is one of the reasons why health and safety requirements dictate that an ergonomic chair should have a proper back support with a lumbar roll that basically keeps the back in a more upright position, and that's largely to try to reduce the pressure on the disc. Now on the other end of the scale, we do see people too who sit in an overly arched position or an extended position, and these people usually tend to have that posture in standing as well, and there are a couple of features that go with that. Usually people who stand in an overly arched position have poor abdominal muscle tone, so their core is not working too well, but in the seated position, overarching throws pressure on different areas, so it's not really the same as just being the opposite of being in a bent position. So when you overly arch, the back goes into an extended position with an increased hollow, but the effect of that is to cause pressure on these facet joints and on this central part of the joint known as the spinous process. And in real life there are sensitive tissues here, ligaments which all have nerve endings in them, and these facet joints have a capsule around them, a sinewy capsule that have ligaments in them, and all these bony structures on the side all have layers of ligaments which are sensitive structures. So when you sit in an overly extended position, it's not the disc that's under threat, it's really these posterior elements, but they can be equally as sore, but that tends not to necessarily cause sciatic pain unless the actual disc height has diminished. And in the previous video we talked about the effect of sustained compression because of the viscoelastic effect squashing fluid out of the disc. The effect of that can then mean that the two vertebrae become closer together, So these two structures become closer together because the spacer has lost some of its fluid content. It's got squeezed out, and when that happens, you get more pressure going onto these facet joints. But the other important thing is that the space for the nerve gets a little bit narrower because the two joints, the two bones have come closer together, and the space in that little tunnel where the nerve comes out of, called the intervertebral foramen, gets a bit narrower. And that gets a bit narrower too when you go into an arched or extended position. So overly arched posture can equally cause a different type of low back pain, but also can stimulate pressure on the sciatic nerve. A lot of folks who get pain from slouching find that if they use stools where they can wrap the legs in behind, which force them into an extended position, that can be beneficial. And while it certainly can act to counter people whose pain comes from a slump position, for people whose pain comes from an overarched position, those kinds of chairs don't really help them at all. There is a reason why they are not recommended from a health and safety point of view. It's because if you don't have support of your spine when you're sitting, your musculature ends up having to work a lot more, and even in the most optimal situations, after 30 or 40 minutes, the muscles in your back start to get fatigued and tired, and that ends up increasing the pressure on the joints too. So that's why these kind of stools and sitting unsupported isn't recommended from the health and safety authorities for that very reason. So, as I started the video by saying, not all sitting is created equal. Sitting slouched is more detrimental than sitting in an upright position, and sitting in an overly extended position can also be problematic, but with some other structures being tested too. So I hope you found that information helpful. If you did, please give us a thumbs up, and don't forget to subscribe to the channel if you haven't done so already. If you have any comments, please feel free to post them in the comment section, and we'll do our best to answer them. I'll see you again on another video. Bye for now.